My name is Myra Wiley and I'm the Program Director for Hands to Hearts Academy. Today we will be demonstrating Pericare for the male for the State Registered Nurse Aide program for the state of Kentucky. With all of our skills, we have our introductory steps of knocking on the door, identifying ourselves, greeting the resident, explaining the procedure, gathering our supplies, and providing privacy. Once we complete those steps, now we perform hand hygiene. We fill our basin with warm water, and then we want to provide safety for the resident and raise the bed for good body mechanics. My bed is a crank bed, so you will not see me raise it or lower it, but I will verbalize when you're supposed to during the skill. So I'm going to raise the bed rail on this side. I'm going to come around to the other side of the bed, and I'm going to raise the bed rail on the other side, and then I'm going to raise my bed for good body mechanics. Whichever side of the bed you choose to work on, you want to make sure you lower that bed rail for safety and good body mechanics for you. I will be working from this side of the bed. I'm going to put on my gloves, and then after I put on my gloves, I will provide privacy for the resident. We always start in the middle of the resident, and we always open our linen head to toe and hip to hip. We want to pull our linen down to the foot of the bed, making sure to keep our resident covered. We're going to place our waterproof pad. So we'll ask our resident to help us turn so we can place that pad underneath them. A lot of students ask, should the pad be up and down or side to side? It doesn't matter. Whatever your preference is, it's okay. Once we have our waterproof pad under the resident, now we'll take our bath blanket and we're going to bring it up to only expose the peri area. You have the option of bending their knees or spreading their legs. Whichever one you choose is more comfortable for you. For demonstration, we'll just separate their legs. For cleaning, you have two options for your rags. You can use 4 corners, where you take the rag, fold it over onto itself, fold it again, and now you have 4 clean sides to use to clean your resident. Or you can use your bath mitt, where you take your pointer finger and thumb, wrap it around, hold it with your other thumb, and then fold it underneath to make that bath mitten, and now you have 3 sides that you can use to clean your resident. I will be using the 4 corners. During your test, you have the option to either use 3 separate rags to wash, rinse, and pat dry, or you can use 1 rag, being sure to identify what that rag is during the skill. So for the male pericare, we want to start with the meatus. You want to clean in a circular motion, using the clean side of the rag each time as you wash. You also want to be sure to tell your tester that if your male resident is uncircumcised, that you will retract the foreskin and be sure to put it back in its natural position once you are done cleaning. Now I'm going to rinse using the clean side of the rag each time. Lastly, I'm going to pat dry. Now that we've cleaned the meatus, now we will clean the shaft. Again, using 4 corners. We're always wiping away from the meatus to prevent infection. 1 stroke, wiping back, using the clean side of your rag. Another stroke, using the clean side of your rag. And washing on this side, using the clean side of your rag. Now we are going to rinse. Again, 1 stroke, using the clean side of the rag each time. Now we are going to clean the scrotum. Same form using the wash, rinse, and pat dry. Again, wiping away from meatus. So I'm washing down, using the clean side of the rag. Now this is my rinse rag, performing the same steps. And now we are going to pat dry. And this is my dry rag. And rinse again. Lastly, I'm going to pat dry. Now we're going to help our resident roll. And we're going to repeat the same steps, and we're going to be wash, rinse, and pat drying from the scrotum to the anus. I'm using 4 corners. We're starting at the scrotum. We're going all the way up, using the clean side of the rag. Now this is my rinse rag. Again, from the scrotum all the way up. And now this is my pat dry. Now we're going to remove our waterproof pad, roll our resident back, dispose of this in the garbage, remove our gloves, perform hand hygiene. We're going to remove our privacy blanket, placing that into the linen basket. We're going to make our resident comfortable. We're going to give them their bed linen back. Make sure that they have their call light within reach. We're going to lower our bed for safety. I'm going to come around to the other side of the bed. I'm going to put this bed rail down. I'm going to put away all my supplies, clean them, put them in storage, perform hand hygiene, ask my resident if they need anything, record and report.